Jen? Smith? Do you have a preference?
No.
All right.
I think. Any of the speakers have preferences?
I think maybe we'll start with the leadership stuff. Does that work? And then we'll move our way into ITT. Cool. All right, so Elizabeth, if you want to come on up first. Okay, so a few weeks ago at orientation, it feels like a blur now. We had you guys just give you a brief overview of the curriculum guide and the acronyms and all the names of the different projects. And what we're going to do today is try to give you a little bit more in-depth instructions. Some dates are going to be thrown out here and there. Some roles and responsibilities are going to be thrown out. And this is your opportunity to post questions into Canvas in that post questions here. That should be listed in the modules, or at least know who the coordinators of those different projects are going to be, so you can reach out directly to them and know what their emails are or what role they serve and see them, well, at least half of their face, right? So Elizabeth will go first, and Elizabeth is in charge of 2 projects, so she kind of meshed these together in one slide deck, so that's what you'll see on Canvas. And if you want to use this, you just left and right. Move this. There you go.
Good afternoon. This is my first presentation in a mask, so this feels really awkward. So I'm new in the role as a family discipline coordinator, but I've been a family navigator in the division for quite a while. So last year I had the good opportunity to do the family-centered care portion of the job, so that's going to help guide me going forward this year. So as Steph said, these are the 2 roles I'll have as far as projects for you all. And then what I want to say is there's far more details on Canvas. Some of them are being edited, but they'll be loaded shortly, so you can get more details there. I'm just going to give a real brief overview today. So related to the family mentoring project, all of the trainees will participate in this experience, except for the Len Light. It's a great opportunity. I was actually a family mentor 3 times before I was a Len trainee. So I think it's a wonderful experience, and I think there's a lot of growth that goes along with it, and it will be nice. The family specialist trainees will be paired up with the family also. We'll pair you up a little bit later on. We're still working on that process. So all of this, as anything in Len, ties back to life course and just all of the different things that you can carry for your practice forward. There'll be 4 visits, as it says, approximately 1 to 2 hours, kind of vary based on the family engagement, and sometimes one meeting will go longer than the others. Ideally 2 in-person visits, 2 virtual visits. In person could be in the community somewhere. It does not necessarily have to be in the family's home. And you all will initiate the contact with the family, and then you will also schedule the meetings. I'm sure you would be very flexible with the families as far as the timing of that. Thinking about always the family-centered principles. So I've listed them here, and next week I will have a training related to FCC. So these are the hopes around the family-centered principles, just building awareness of them. The project allows you families. Well, I'll back up a second. The family-centered care project is a little bit different than the FMP project, in that I will be watching your evaluations or your ISS trainings, and the family discipline folks will also, 4 of the opportunities of evaluations, they will participate in those 2. So in this aspect, it would be those 4 principles that I listed on this slide that we'd be looking at. And I want to tell you that one of the documents that's saved under family-centered care will be the evaluation tool that'll be used. So sometimes it's very helpful to kind of see what kind of things that we'll be looking at. And do know when we do these evaluations, last year I found that the trainees were nervous about it or nervous with meeting me and we did it over Zoom. But know that it's all done in a positive manner. And when they got on the backside of having it done, they just felt like it was a really great experience and they learned a lot from the feedback. So as I said, the evaluations will be done by me and then 4 of them by the family specialist trainees, and all the stuff is on Canvas. As I said, I would be brief today. I'm happy to field questions. As Steph said, you could send them my way, but I'll open it up and see if you have any questions right now about the 2 projects. Yes,
For the
Kate?
mentoring project, do those 4 visits happen over the whole year, or is it just in the fall or?
Yes. So that there's a nice document that will be loaded into Canvas if it isn't already. And it outlines exactly the 4 visits, the timing by which they'd be due to happen.
Okay.
And we've also listed in some really nice prompting questions, thinking about things. You don't have to stick to those, and feel free to come up with your own ideas to discuss with families, but just kind of themes. And then you'll write a reflection. But all of that, I think, is really outlined nicely in that document to answer your questions.
Okay.
Anything else? Yes, Amy.
I'm sorry if you said this and I missed it. Do you know about when we'll get our matches?
Is there some timing on that stuff? Okay.
Okay.
Our hope is to geographically match you, so you're not driving from Westchester to Kentucky and stuff like that. I think there might be a family that will be exclusively virtual just due to their family dynamics right now. And is there anything else you need to add, Steph, about that?
No, I mean, I think Jen has historically helped do those matches to make sure that.
Okay.
If you all have kind of a strong preference with regards to disability, like disability type, and location, those are kind of like the 2 criteria that we look at the most. So if you have a really strong preference for that, you can let us know, but otherwise we will match you guys up based on what we know.
Yeah, and on Tuesday at the Family Center Care, Patient Center Care session that Elizabeth will lead, we can just have you kind of share that with us then during that session and kind of.
Yeah.
We'll have a sign up sheet or something.
Yeah, that's what I was just thinking as you were saying that stuff. And I don't mean to sound not knowledgeable about the timing of it or the process of it. I'm learning what the process is too. So I'm glad that I did hear that Jen will assist me with that. So here's my contact information. If anybody.
Sorry, I just have a quick question.
Oh, I'm sorry, I missed that.
That one's good. Yeah, that one should work.
That work? Okay. So my question was just if we're going into houses or meeting them, not at a house, but maybe indoors, are the families that we're working with, obviously will be in masks? Obviously not the kids, but will the adults that are attending, are they instructed to be in masks or to notify someone if there's sick? Anything like that?
Yes.
Okay.
No, all of the COVID precautions that we have at the hospital would be shared with them. And at any time, if you don't feel comfortable doing it in person, that's totally fine. We'll just do virtual.
Okay.
We're very flexible with this. And again, we may say in 2 weeks, oh, the COVID numbers are high again. We're just going all virtual. We just learned last year that some of the trainees, once things did open back up a little bit, trainees were like, oh, I really wanted to meet that family in person. So we wanted to give it an option. So we say 2 and 2, it could be 3 and 1. It could be 1 and 3 the other way, right? It is completely flexible with what you all feel comfortable with, what your families feel comfortable with. And like Elizabeth said, we've already heard from one family that they are at a place right now that they can only be virtual. So, but we found that having that family as a mentor was that valuable that we were like, okay, virtual is better than nothing. So good questions, good questions.
And you can be really creative with that. I remember when I went through on one of them, we went to see them in a play. So, short school play. It was so great to see them in their natural environment and doing a fun activity and how they engaged with their peers. So.
Is this something that we record or we can like take notes during for the written assessment?
Oh,
or
yeah.
Assignments?
You can, I wouldn't recommend you probably recording on Zoom unless you get the parents' permission ahead of time, and most of them are gonna be fine, because most of them are honestly former Lend trainees. But definitely taking notes, jotting down your ideas, making sure that you're recording what they say in terms of your questions, so you can reflect on those later, absolutely. I mean, obviously, it's one of those things that like, they might invite you into their house for dinner and, maybe not bring the computer to the dinner table, but use your judgment and kind of go from there. But again, only what you feel comfortable with.
Yeah, because there's prompting questions on there, but I want you to like be a bit more relationship building, not an interviewing type of thing. So.
Johnny, you have a
Yeah,
question?
I just for me personally, maybe some of the other parents and other people, four of us. Can you explain just briefly exactly what's gonna look for us in this
Same,
process?
the exact same.
So we're gonna have a family.
Mhm.
Now, are we a part of the people helping evaluate? Like, was
No,
that?
so that's a different project.
Because you said family specialist, and I'm
Yeah.
like, okay, does that
Yeah.
include it? I'm just-
So that's a different project.
Okay.
Yeah, I didn't make a clean
No,
break on that. It's between the
Yeah,
projects.
so FMP will be the same for everybody. We'll just make sure that we don't assign you to a family that has a child with a diagnosis similar to your own experience. FCC, Family Centered Care Observations Assignment, that will be something that Johnny, you will not participate in because you'll be doing your work with adult services.
Right.
Michelle, Olia, and Tulika will participate in to help Elizabeth observe the clinical trainees. Now, the people clinically that will not participate, or no, I'm sorry, the non-clinical people that won't participate in that are Katie, Greg, and Ramya. Everybody else sees patients in some way, shape, or form through their clinical experiences, correct? So, okay. So there'll be 3 people that will not participate in that because they'll be doing other leadership projects through their discipline. 4. Jotty, Greg,
Well, what if I want
Ramya. Well, then, yeah, that, we can definitely, and I would say we can definitely talk about that. Because that could be something that down the line we add in for you because you have that lived experience. Same with Greg. You guys have lived experience. If you want to help, that would be great. We just know that you'll have other things that kind of fill that time, but it could be something that it works out like, yeah, I'd really like to do at least 1 or 2. Yeah, totally. Great questions, guys. Really helpful for us to know for next year. Yeah, great. Okay. And I don't want to forget Kavya and Maddie. Any questions, just speak up, okay? All right. So, Aaron, I'm gonna hold off until we do Lisa and you at the same time, since it's an either or. Sound good?
Yeah, that's totally fine. I just thought I'd put it on you all on in the background so you were ready for me.
Yeah, because we're just fun to listen to.
Yeah, I love
Yeah.
coming to Lend whenever I can.
I know, right?
Yeah.
Okay, so I'm gonna do mine then real quick, and then we'll have ITT jump in. And EV case. We'll do discipline, EV case, ITT. Does that sound good? Okay. So next up will be your disciplinary presentations, which are gonna be one of your first assignments coming up here soon. Oh, no, I can't see them. Is it that one? No, I need to do screen 2. Okay. So ultimately, there's the same bits you heard in orientation. So I'll be the coordinator for these. If you have any questions, just like we said earlier, you want us to look at your slides, feel free to contact me. You want to use one of the materials, I will throw those into the disciplinary assignment piece, all of the different options that you can check out via online and let me know if you want to use one or test one out, and I'll give you the username and passwords for those. So this is an opportunity for you all to teach each other about your disciplines. And like we said a couple weeks ago, it's that step towards building your knowledge and then changing your attitudes around the values that you place on other people's work. So everybody per discipline is going to get 12 minutes plus 3 minutes for question and answer. And I'm going to have to be a stickler because excitingly, we have like a ton of disciplines. So we have to make sure that there's enough time across 2 sessions, so 4 hours total, to give everybody time. So the disciplinary team or the individual will have 12 minutes and then 3 minutes. Every trainee must have a speaking role, and it would really be preferable if it was pretty equal. So we don't want to, like, Maria comes up and she introduces developmental behavioral pediatrics, and then she's like, Suma, take it away. And then Suma does the rest. Like, that doesn't give us enough of Maria talking to really evaluate Maria's presentation skills, right? So some important dates, and again, these are both in the assignments list as well in the disciplinary assignments module. On September 27th, genetic counselors, grad nursing, psychology, peds, that's developmental peds, OT, PT, social work, and speech. You will need to email your draft presentations. They don't have to be 100% ready to go, but a draft to your core faculty for them to give you feedback and kind of approve. Then you will be presenting on October 4th. Then on October 4th, those remaining disciplines, ABA, audiology, adult services, advocacy, community engagement, family, and public health, you guys will submit your presentations to your core faculty. And when I say core faculty, it could be your supplemental faculty as well. So I know Jadi's with Anne and Ramia's with Nicole. But you would provide your feedback to them, or they would give you feedback by October. You would submit your slides so you can get feedback by October 4th. Then in class for the 1 to 3 session on October 4th, that first group of disciplines will present and take turns. And then October 11th, that second group will present and take turns. Okay. Then after that, the third step to this project is that the first group of disciplines that presents on October 11th will submit a self-eval on what you think you did well in your presentation into Canvas by October 11th. You can do it right away if you want, but you can do it a week later, whatever you feel like. Then the self-evaluations for the second cohort of folks will be due October 18th. So it's 3 weeks in a row, basically, that you'll be doing something related to this project. It's just staggered. And that's it. Pretty straightforward. Canvas has the instructions on the main domains that you'll cover in your presentations. You don't have to use PowerPoint. You can use whatever feels good to you. Just make sure that we can upload it later so that your peers can see your slides as we go throughout the year. What questions do you have? Yeah, Lisa.
I'm assuming for psychology, our faculty would be Lindsay Mays.
Oh, Lindsay Mays, that's right. Yeah. So actually, you can send it to me.
Okay.
Yeah, because she will be gone by then. Well, let's hope.
I was gonna say,
Let's hope she's gone by Tuesday because she's due on Tuesday. So yeah, you can send it to me. Good question. And Kavya, I think Lori will be back by then. But if not,
I told her that I would.
yep, I was gonna say, turns out Jen also has a BCBA, so you can send yours to Jen.
Okay, perfect. That was my question, so thank you.
Oh, great. Okay, perfect. Awesome. Any other questions? Yeah, Suma.
Both me and Maria are gone for like 10 days during some of those things. So I don't know that like with the schedule because of our boards.
Let me look at that again with your times
Yeah.
and we'll figure something out. Does that sound good? We may swap or we may just,
Yeah, like we might have to.
yeah, but thank you for bringing that to my attention. I knew that. We did them later this year. Normally we do them a week earlier. So, all right, we'll figure it out. Okay, next up, let's see, Evie Case. Sally and Marta. Oh.
Huh, only a couple years old. The rest of the side's probably.
Oh, no.
It's all good.
Where did that come from? So this is not Sandra Grether, if you haven't put that
not.
together yet. I don't know how that happened.
Well, let's see how old the rest of the slide is.
It's all good.
Right.
Kavya, Maddie, can you guys see the slides, evidence-based case discussions on Kavya, if you can give me a thumbs up?
Yeah.
Okay, perfect, great. There you go.
Thanks. My name is Sally LaCroix, and I'm a physical therapist. I primarily work at the Mason campus, but I'm the core faculty for physical therapy for Lend. And I get to work with Miss Marta Getz a ton because we both work on evidence-based case discussions and on interdisciplinary training teams. So I will see you on most Tuesday afternoons. We're going to talk a little bit about evidence-based case discussions. And really the purpose of this piece of Lend is to have case-based discussions that are interdisciplinary and family-centered around children and youth with developmental disabilities. So each of the classes will cover a specific developmental disability, and you'll have the opportunity to learn from specialists who see children in an interdisciplinary clinic in our institution. And so something to keep in mind is that we hear a lot about evidence-based care, and a lot of folks put emphasis on the evidence piece of that triad. And it is super important that when we are considering what is evidence-based, that we are looking at, how good the evidence is, how replicated it is over several different studies. But you have to also consider that where there's a lack of evidence, clinical judgment is still a piece of this puzzle. And there's very few things, having been someone who's developed a clinical practice guideline and is working on another one, there are very few things that are black and white, that the algorithm says do this and I do that with this child, or I recommend that intervention, because there are other pieces or puzzles, pieces to the puzzle that come into play. And so clinical judgment is still a big piece of what we do. And it's also super important to remember that patient values and family preferences are also a part of the evidence-based medicine triad. And this piece of Lend will help connect evidence in the literature to practice. So there are 7 different conditions that you all will learn about this year. There will be 4 in the fall and 3 in the spring. November will be a super hot month for EB case. And so it's time to start thinking now about how you're going to stay on top of some of the assignments, and we'll mention what those are. The first one will be on spina bifida and myelomeningocele, and Marta works in that clinic as a social worker, so she's got a lot of great experience, and then she'll bring the team to talk to you that day. We'll learn about attention deficit hyperactivity disorder, Fragile X, and Down syndrome will all be covered in November. That'll be the 1 to 3 time on Tuesday afternoons in November. And then in the spring, we'll learn about developmental coordination disorder from some of my colleagues, feeding disorders, and vision impairment. There are a number of different MCH leadership competencies that EBCase covers, and that includes the knowledge base and context. So you're going to learn a lot about the disorder itself. The first hour of the presentation will be by the specialist explaining about the condition, how they evaluate and treat that condition. The second hour will be split in half. The first part of that will be a case study that they'll review with you and hopefully get some of your participation. And then the last 30 minutes, we will ask a family member, a parent or caregiver of a child with that developmental condition to talk to us about their experiences with the evaluation and treatment of their child. And those will still happen by Zoom. So that is one of the things that has happened as a result of Lend, is that we've been able to include more folks because we can have them just get on camera. And sometimes their child is right beside them and they're talking with us too. And so that's just been a really neat part of the learning piece. Other pieces of the leadership competencies are ethics and critical thinking. communication and cultural competency, family professional partnership, interdisciplinary and interprofessional team building, and then working with communities and systems. So here's the activities. You are going to read an article provided by the clinical team. These are already uploaded to Canvas. So if you go to the first Tuesday in November for spina bifida, you will already see some required readings for that class. We need you to respond to the question that's provided on the discussion board, and that has to be before we actually meet for that class. So you need to be thinking and putting in your calendars a week or so ahead of the spina bifida lecture. I need to read those articles and I need to be getting on the discussion board. Discussion board posts are due by
Tuesday before the event. So
probably 2 weeks ahead. Does that make sense? So
you're supposed to, if we're talking about, not looking at a calendar, if we're talking about ADHD on Tuesday, November 8th, that means my discussion board response is due by Tuesday, November 1st.
1 week ahead,
1 week.
11:59 PM, always moving forward. Everything is due 11:59 PM.
yeah.
And I will send you little love notes if they're not there. So I go through and I read your responses to see if there's some themes in the questions and the things you're talking about to try to give the presenters for their session the following week. So if you guys are talking about a lot of the same things, they're proposing a lot of the same questions, I want the presenters to have that so they can address what you're curious about and what you're talking about.
So my advice to you is to get yourself organized now and put that in your to-do list to read the articles 2 weeks ahead and have your discussion post completed the week before that class. I will say that every year and maybe a little bit more so when we were doing things more on Zoom, is that the sort of like repetitiveness of having those 4 weeks in a row, people get a little tripped up. And the very first one, folks are like, oh, wait, I forgot that was a thing. I'm telling you now it's a thing. And it's 2 weeks ahead of the first Tuesday in November. Get yourself ready and have that posted 1 week ahead. You're going to comment to one post on the discussion thread. And you're also going to look a little further into your discipline's role with children with this diagnosis. So what are some common tests and measures or interventions? What are some common findings in your discipline's evaluations or assessments, and common outcomes with or without interventions? We'd like you to participate in the classroom discussion on the topics. You're going to be able to ask questions of the specialists and of the families that participate. And that is it. Anything you want to add to that, Ms. Marta? Awesome.
Carry slide down so that I can close my emails and click in those things.
Oh,
Do you guys have questions?
I do. So the discussion post is due a week before.
Correct.
When do we have to comment on someone else's?
A week before.
Oh, okay.
Both responses are due a week before.
Got it.
The prompt is the same prompt for every week. It's the same prompt. Social determinants of health related questions to this diagnosis, about living with this diagnosis. The readings are also about living with this condition. So the prompt is the same. So don't be surprised. It is right, but it's the same. And then we want you to, so somebody gets to be the lucky person who starts. And somebody has to start it. And when you start it, there won't be anybody else's to respond to. So that lucky person has to remember and go back to respond to someone else. That person often forgets, and I send you a little love note, like, thank you very much for starting the discussion. Can you pop in, like, just read somebody else's and just give a comment? But if you start it, you might get a thank you from me for starting the process. Somebody has to start.
Any other questions?
ITT,
Okay.
Kavia, you can see those now. ITT, case management leadership training. That's not correct.
That's not right. What did I send you?
I don't know.
I don't know what I sent you either.
Okay. Just kidding. Oh, please.
That's at the end.
I know.
Yeah.
Gosh.
We do still need.
Yes.
Let's talk about this first. Right. You don't know what it is yet. You can't be a leader in it yet.
I don't put them in there.
Nope, that's right.
Because I'm bad at that. You may send it. Is it- Or can you download this?
That would not have to be on campus.
Oh, okay.
Can you log into your email? Or I mean your OneDrive? Is that easier? Nope.
There's also a comment in the chat.
Thank
Or
you.
Oh, no, it's just us for our attendance. But thank you.
Oh, thank you. Katie, the chat box champion over there.
And we will ask for chat box champions on a regular basis because that's really helpful in ITT if you folks are coming in from house
Why don't
or
I
EDK.
do this?
All right, it's coming your way.
It's coming to my email.
Yes.
Thanks for your patience all. Let's see what Tina Chang's telling us. Oh.
Yes.
I think so. Yay, okay, we're gonna close out this.
Yeah.
And we are going to do this. Yay, okay, now Fabia, can you see IT interdisciplinary training team? Beautiful.
Cool. Okay. Sally and I are still here. Lindsay usually does this with us, so Lindsay will be a coordinator with us in the spring.
Lindsay's a psychologist here at Children's.
And maybe she'll be here next week, but probably not. But now we come back in 2 weeks. We come back in 2 weeks and we do a 2-hour talk all about ITT. So you're gonna hear a lot about this one. So interdisciplinary training team purpose is to involve all of you in the evaluation process of a child referred to developmental behavioral pediatrics. So it's collaborative interdisciplinary team evaluations. And then we also talk a lot about the role of the evaluation process on the child, on the family, and how that's an intervention in itself. And some of you in here today will learn you got picked to be in a leadership role for ITT. And you are lucky. So we will hold you at the end and go over what that means specifically, and you'll find out who you are. So it's also a time to really learn about other disciplines. There will be, all of these will happen in person evaluation, fingers crossed, that everyone stays healthy, us and the families stay healthy, so that I don't have to change everyone's schedule 1,000 times. And we'll learn about evaluation processes. We'll see what evaluations look like across disciplines. How do disciplines overlap? How do we complement one another? What if I am going to say I'm not going to be a social worker? What if I'm speech, but I have this question? Who do I ask that to? So you hopefully get some more information about not only the role, but what the other disciplines do. And then also working together to come up with diagnoses that we share with family, treatment recommendations, and treatment planning. And then how do we work together to communicate those things and help families prioritize next steps? All this very similar MTH leadership competencies with ethics, critical thinking, communication, cultural competency, family professional partnerships, obviously interdisciplinary team building. It's what we're going to spend a lot of time working on. Working with communities and systems. So ITT will start on September 13th. Sally and I are going to talk a lot on that day. Kind of fast. Our ITT meetings are here. These are in 2 places on campus. They are almost etched in my memory completely. I made 2 different schedules because we heard that one schedule is hard to read. I made a second version of the same schedule. Use whatever schedule is easier for you to understand. So basically, you're going to be divided into 2 teams. We have team 1, team 2, not creative, team 1, team 2. Once we get started with ITT and having evaluations with the child, You basically meet pretty much every other Tuesday from 3 to 5. So if it's ITT meeting day on October 11th for team 1, that means team 2, you are free to do what you need to do from 3 to 5 on Tuesday, October 11th. You won't have to stay here. You can do other Lend activities, you can do clinical things, you can do what you need to do. So it's pretty much every other Tuesday, though that may not always be perfect, so check the calendar. So September 13th, we start together though. So we're all gonna be here September 13th. We're gonna learn about our 2 kiddos and we're gonna hear a lot from Sally and I. December 6th, at the end of the process, so all the evaluations, anyone who works in DWP, all the evaluations take place between September 27th and the end of November. One kiddo needed to move their information sharing session to December 6th. We'll deal with that. But we're all gonna come back together on December 6th, re-meet the kiddos each team had, because the other team won't know anything about what happened to your kiddo. And then talk about the process as a team, whole team on December 6th. These are your teams. I have one edit, which I will make upstairs later. So this might be hard to read. It's on campus. If you're not sure what team you're on, reach out to me. The asterisks mean, one asterisk means non-clinical. No. Leadership team members. Your leadership team members. The next slide is, that's coming, what exactly your role is. If you want to see yourself, team 1, team 2. If there are 2 of you in a discipline, you're on opposite teams. Trying to spread all the disciplines out.
If there's one of you, then you'll be here every week, Caitlin and Sam, with PT and OT. Is there anybody else that affects?
Audiology, you
Audiology,
do not
Griffin.
come every week. This is like later. You're assigned to one team.
Team 2.
Team 2. You come to the team 2 meetings. You do evaluate both kiddos, and there will be one team 1 meeting you come to, just to go over your evaluation.
Okay, that was gonna be my question.
Yes, perfect. It's all in the schedule. If you have questions, let Susan or I know. We'll help you. Any other questions about what team you're on? So the meeting, so we have this meeting from 3 to 5 on Tuesdays. The average length of a presentation is about 20 minutes. Some of you need 5 minutes. Some of you are gonna say, can I have like an hour? Yes, we will work on that. When I go over everybody's role, there's going to be a person who will reach out to you on your leadership team and say, how long do you think you need? And we'll plan for that. In social work world, if we've got a pretty intact family, we say, we'll take 5, 10 minutes. When we go with psychology and they say, I need to go over, I did 10 different tests and I got all these results. Can I have an hour? We'll say yes. So I try to schedule the meetings so that we have some of that balance too. Some meetings are heavier than other meetings. So you might be told, no, you can't have an hour, but you can have 40 minutes. And we'll try to get everything in and we can always carry things over to our next meeting. You don't have to use PowerPoint, but we want something visual. So if you like a different visual item, that's fine. Something like a PowerPoint, a few slides. We want to know, what tools do you use? Do you use standardized measurements? Do you talk? If you just talk, or there are certain questions you probe with, those kinds of things. Why do you use what you use? And then what are you looking for? What are you kind of digging at? What is your discipline looking for? Then the testing behavior. What's the kid like? What's the family, depending on your discipline, what was the family like versus what the child like? Summary impressions. And then if you have scores, so if your measurements come up with scores, we would like to see them. So these are the normal evaluations you're going to do in your discipline anyways, but you're going to teach all of us about them and why you pick and why you do what you do, so that we have a better understanding about your discipline and what happens during your evaluation.
And beyond the evaluations, you all will ask each other questions about why they chose this test, or dig a little deeper about what it means, and maybe some other findings that weren't reported. So beyond the presentations, there'll also be active discussion that happens during those meetings.
So,
So,
sorry, what's in red?
yes, it's wrong.
Change that color and it's wrong.
It's
It's
today.
Today.
It's today at 4:45, not September 30th. So these are your leadership teams. If your name's up here, you got picked to be on the leadership team for the fall. So some like Maria and Sue, yours, the leadership for the evaluation, you're the evaluation coordinator. We're gonna talk to you more about what that means, but you're also gonna run the ISS, the information sharing session at the end of the evaluations this semester. So if your name's up there, we would like you to stay at the end of the day to meet with Sally and I a little bit more. So you understand what your role is and what those expectations are. Any concerns?
The only thing,
Yes.
well, Leah and Talika will not. And so it'll just be one of those things where we have them meet with Elizabeth and you guys later on.
Work for me? There are some assigned readings on about interdisciplinary teaming. We would love for you to read them before we come back in 2 weeks. Any questions?
I think the only other thing that we'll cover in 2 weeks is Marta, the microphone and Zoom computer.
Yeah.
Yes. Because we will be recording your evaluations.
Yes.
So that they are available for folks to review as part of project.
Yeah. Yes.
So more to come on that, but anytime you do an evaluation or any interaction with the family for ITT, it will be recorded via a Zoom and protected via our private YouTube channel and only shared amongst this group of friends. And families know that this is all for training anyway, and they've given their approval.
And at
But
their first visit,
yes,
I meet with them and they sign the official children's form saying they are fine with the recording. But we've already prepared them and asked them if they were comfortable with this. And so they're aware that there's going to be a Zoom session going on in the background.
I can't remember, I'm sorry. Did we mention that they also get all of these services free of charge?
We didn't talk about that. We
Yes.
don't bill for these. So I promise someone along the way is going to want to bill and it's not your fault. And when it happens, I just need to know about it. So if a family tells you during the evaluation process, I got a bill, please let me know so that I can clean it up on the back end and just ask people.
That's a huge draw for these families is that they get this giant comprehensive evaluation, all the reports and recommendations that go with it without us billing their insurance because it is for educational purposes.
But I would work really, 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 really hard to not let any charges drop as a result of your eval.
And if you don't know what that means, don't worry about it. You won't
Ask
need
your
to know what that means.
That's your clinical
But
supervisor.
just talk to your clinical supervisor and say, remember, this is the LEND case. We don't bill for this. But again, these will all be recorded. So when Lisa gives the psychology evaluation, that day she will be responsible for getting the LEND computer, taking it down with her, setting it up, making sure Zoom is being recorded. There'll be a special team 1 Zoom and a special team 2 Zoom. All of that will be more explained as we go. And individually explained when you do your appointment. Because, again, dun da da, those recordings are valuable for our observations across disciplines project. Thank you, Marta and Sally. I know you're gonna be hanging around anyway, because I'm sure there's gonna be more questions that come up for you guys. Kavya, you can see observations across disciplines, right? Great. Awesome, awesome. Thank you, Carrie. No problem.
Hi, everybody. It's nice to see you all in person. I am Carrie Atzinger. I am the genetic counseling faculty for the LEND program, and I'm the point person for the observations across disciplines assignment, which is part of ITT. I'm going to talk a little bit about the goals with observation first, and then get into the details of what you need to do. Okay, so when we think about observation, It can be passive, I'm just watching this thing, or it can be active, and I want this to be active. So that's why we're going to talk a little bit more about that. With passive, you're just sort of observing everything. It's a little bit superficial. You're not really looking for anything in particular. With active observation, you're looking for specific aspects, and I'm going to tell you what those are, to focus your observations so that you're able to process it and get something out of it. So just for fun and to demonstrate. Oh, good. We're going to watch a little video. Oops. I'm gonna go over here.
Carrie, I don't think they can hear the video. Zoom.
Sound doesn't really matter. So did anybody notice any of those changes? No. But if I had told you, hey, look and see if you see anything that changes as the video goes on, you probably would have noticed at least one. So the point is, you can't, an observation is better if you know what you're supposed to be looking for. And it's just fun. Here. All right, so what should you be looking for? In these observations, you're going to focus on these two MCH competencies. So interdisciplinary and interprofessional team building and family professional partnerships. And I really encourage you to read through the reflection questions that are in the assignment before you do your observations, because it'll give you very specific things to think about in terms of these. So for example, for interdisciplinary and interprofessional team building, describe ways that this observation might impact how you communicate or collaborate with individuals in this discipline in the future. So if you're observing audiology, what does that teach you about what an audiologist does that might help you communicate with them in the future, or things like that. And then what do you observe about the communication between disciplines in a setting if there are multiple disciplines there? Or because for the fall, at least, you're going to be observing ITT sessions, you'll observe the appointment, and then you'll also hear the communication in the room. And so how is that influencing, like how does what you saw influence how you take in the information in the team? And then in terms of family professional partnerships, what piece of information or aspect of the visit do you think had the greatest impact on the patient or family? You're not going to know that for sure, but what is coming across as impacting the family? And then what are the positives and negatives about how if it's a multidisciplinary team, like how it's structured and how that might be positive or negative from a family's perspective. And then, as I mentioned, you're going to write a reflection. And I wanted to give some examples of what I'm looking for in a reflection, again, just to be clear. So these are all observations and all reflections on observations, but I'm looking for something that's more on the left-hand side. So on the right-hand side, things like the teamwork and cooperation in recording the data was impeccable, or I'm really glad I was able to observe in this clinic, I'll recommend it to other trainees. Those are fine things to say, but they don't tell me very much about what you got out of it. They tell me you liked it or that it went well, but not why. The one in the middle is sort of in between. So I never really understood the pitfalls of the medical model that we talk about a lot in grad school until I sat in a meeting with a whole team of medical professionals. That's great, that's almost there. Like, I just want to know what do you mean? Like, in what way did you understand it better? What about that team interaction helped you to understand that? And then the one a little bit more developed. So I realized that the professional I observed gathers a lot of psychosocial information that's important to my work. If I work with this professional in the future, I'll be sure to consult them about not just the medical information, but the psychosocial information. That tells me exactly what you observed, what you took away from it, and what you're going to do with it in the future. Does that make sense? The reflections don't need to be long, but focus more on what did you get out of it? What are you taking away? So the details of the assignment itself, obviously they're all on Canvas. You're going to do 4 observations across the year, 2 in fall and 2 in spring. So right now what you need to focus on is just the ones for fall. You're going to observe 2 disciplines that are not your own. So, and you're going to observe 1 evaluation by a member of your own ITT team, so the same patient that you're seeing, if you're in a clinical discipline, and 1 observation of a discipline evaluating the other team's patient. The reason for that, 1, if you're observing the patient that you're seeing, you're gonna have a lot more context, you're gonna know what's going on, you're gonna hear the conversation in the ITT room, so you're gonna get different things out of that. But observing a patient that you know less about may give you a flavor for, what does just that isolated visit look like for a particular patient? So, and what is the communication like in the room? In the spring, it's still to be determined. We'll see how COVID goes. Hopefully we'll get you observing in lots of different multidisciplinary clinics around the hospital and around DDBP, but I'm just gonna give that a few more weeks before we decide that for sure. So for fall, those observations, both of them are due by, and the reflections are due by November 29th at 11:59 in Canvas. And yeah, does anybody have any questions? Yeah.
The observations, are they in person, or I know they said everything's recorded when you watch?
Everything's recorded, so you can watch the recordings. I don't know that there's any need to be in person.
So the question was, do they have, the observations have to be in person? And I would say preferably this semester, no, just to mitigate the volume of people that are in observation decks downstairs, that kind of thing. Marta, were you gonna say something else?
You can't observe them live remotely though, right?
Oh, yeah.
There will be a Zoom link for each of the sessions, so if you want to observe it live, you can observe through Zoom live. We will give you some instruction that please mute and please go off camera, and we'll let the family know if there's going to be live observers. So but that means if you log on that morning, you don't have to tell me ahead of time. If you log on that morning, whoever's evaluating, please just explain to the family, we have somebody watching live in our team. So you can watch the recorded Zoom link, or you could watch live on Zoom the day of the event.
Good question, good call out.
It might be nice when you can to observe live, because then, or at least before that discipline then presents in ITT, especially for the team that you're on, because then you'll have seen their evaluation before they present, which might be nice.
Go ahead, Johnny.
How do you figure out when these are taking place? Like, so I decide I want to watch speech and audio, speech therapy.
So in
Your ITT schedule.
Yeah.
And Marta mentioned there are 2 versions of this. It tells you every day who is. If I can get to that.
yeah, so it'll say in
It tells you who's evaluating the child, and it also gives you a presentation date. So you just look at this, you can highlight on the schedule, but it's also in the big packet.
It's all on Canvas.
This is what one of the versions looks like. Yes.
The slim down version that people ask for.
so you should be able to see there then when all of them are, and then
Might be hard to read on today, but again, Marta has done a beautiful job of making sure they're up to date, and then if they get replaced, she will update them. Just like I've said, I'll do with the assignments, if anything changes, we will update them and take off the old stuff, so you may need to check back if you've downloaded something or printed it out, just check back, but we'll also let you know in announcements, hey, we made a change to what was posted to Canvas, go back and check.
I make a lot of announcements. So I send out a lot of announcements, which should, if you have your Canvas set up, it will email you that I made an announcement. I will not email this information. I will not email ITT information to external CCHMC emails, because then I have to send it to you encrypted. And that's just a lot of steps for everybody involved. So ITT information may show up in your children's email, but not really unless I tell you, check your children's email. A couple of you who I'm gonna say, check your children's email. Everything in Canvas, we'll talk about this more when we come back. Canvas doesn't have any patient identifying information in it. It's not to the encryption level that children's needs for security purposes. So no patient names, no medical record numbers go on Canvas. Everything just says team 1, team 2.
Also in your assignments, don't put any personal health information for those reflections, just what does it, if you look in the assignment, it'll tell you what to put at the header of your page. It's just like, who are you? What is your discipline? What discipline did you observe? Which team, what your team or the other team, that kind of thing. And then your reflection. Each reflection should be less than, it should be a page or less.
Do we just choose for ourselves which disciplines we'd like to observe?
Yes, as long as it's not yours, you can pick any other discipline to observe. Cool.
Pass it behind you there, Mash.
I just ask, like, you're gonna do 4 total so that they're all different. Unless, if in the spring we have the opportunity to observe a multidisciplinary clinic and your discipline's in that, like, that's fine, as long as there's somebody else there too.
So I see like on the schedule that like the fellows and genetic counseling and like social work are all kind of in the same time frame. So do you want us to write like the reflection about all of them? Like, can we include them all in there, or do you want us to specifically focus on one?
I would focus on one. I mean, you can add a little bit about the other if you want, but I would focus on one. Yeah, very good question. Yeah.
Let's bring this up here. Sorry. You're fine. Yeah, you guys can pass it up.
So I think I remember you saying that it's recommended to observe one kid that is part of our ITT, and then is it just natural to observe a kid that's in the other team's ITT?
You need to do both. So one on the other team and one on.
Oh, okay. No, thank you.
Yeah.
Anything else, Carrie?
Yeah, no, I'm good.
All right, I think we need a break. Stretch break.
Step out.
And then Erin, can you put them in? Yep, you got it. And a couple more people in the room are coming in.
Okay, I can wait.
Okay, do you mind to show your face so we can see your beautiful face?
Yeah, I'm sorry. Am I here now?
No, yeah, there you're perfect.
Oh, okay. Yeah, I was just trying to move all the faces. Whenever it goes into share my screen.
Oh, yeah,
Like
yeah.
hides how I had everything.
No, we're in good shape now. Okay, so we had a little bit of a break. I want to circle back to a question that Ramya had. That was a fantastic question. More to come on the FMP, the Family Mentor Project. You will also be partnered up with someone else in the cohort. So you won't go to the family's house and meet with them on your own individually. You will go with a partner. So again, more to come next Tuesday on that. But that was a good question she had that I was like, ooh, I think everybody needs to know that. Yeah. Okay, any questions on the other projects? All right, and just to reiterate, if not otherwise specified, everybody does all the projects we've previously talked about. Okay, except for that family-centered care observations that some of the non-clinical, non-patient facing trainees will not do. Everybody does all the other projects. With these two that we're about to talk about, you choose one or the other, okay? So Erin, if you want to go ahead with the early intervention project, take it away.
Okay, great. Thanks, Steph. My name's Erin. I am the coordinator for your early intervention project, if you choose to do that. I was a LEND trainee 2 years ago now, I think, for community engagement. And so both this project and Dr. Hunter's project, who she's going to be talking about next, are the projects you can choose between, but they're both amazing projects. And still to this day, I'm involved in both of them in some way. So I highly recommend both experiences. I hope that helps you choose. Okay, so for this project, you are going to, some of it will be in person or virtual, and that's going to depend on the providers that you're following in the early intervention program and the family's preference. The providers are starting to go in homes, so you will observe with whatever the provider decides to do. The goal of this project is to recognize the importance of trust in family and professional partnerships, identify principles of cultural and linguistic responsiveness, and reflect on your own implicit biases. So this project kind of entails two different things. You'll observe one home visit and you'll complete the home observational tool. All of these are on Canvas, but at the end of these slides, I'll go ahead and just pull them up just so you can take a look at what they all are. And like the previous project, it is a form to just help your observations. You don't know what to look for unless you know what to look for. So it just gives you some things to think about while you're observing your visit. Then you'll also attend an interdisciplinary team meeting and or an individualized service, family service plan. So depending on your county that you're assigned, what their preference is. I know the county that I got assigned as a LEND trainee required that I come to a team meeting before I was allowed to go in the homes with my provider. So that was one that they wanted me to do. So that was one that I did. But hopefully you have time to go to each, because you will have 8 hours total dedicated to this project. And this project can be completed in different time periods throughout your LEND year. So you can decide based on what other projects you have going on. You can complete it in the fall semester. So take the whole fall semester to complete your 8 hours, or in the spring semester, or you can chunk it over winter or spring break. So if you're going to be in town around those times and just want to get it over with in like that week, you can also do that. The counties we work with are Butler, Claremont, and Hamilton counties. So similar to the family project that you get like paired up based on location. In the survey, it's similar to that too. We try to pair you up with the county that you would be closest to, but also some counties put on limits how many trainees they'll be taking. So it just depends on how that all shakes out and how many of you choose to do the early intervention project. And again, depending on the family and the provider, some visits may be in person and or virtual. Also, I was told this is my first year doing the project, so I'm super excited to work out all the kinks with you guys. So I was told also that I believe that for PT people, this can double dip right into your program and hours for this project. So you might do more than the 8 hours for this project to complete the requirements of your PT program. But just throwing it out there, it can double dip. So for next steps, you'll complete the survey, which I think is it ready, Steph?
Yeah, I think Vicky will either send it out or already has sent it out. So.
Okay. So Vicky, it'll come from Vicky. It's a REDCap survey for those of you who are familiar with what those links look like. And it'll have you pick which project you want to do. And then based off of that, we'll go ahead and I'll look at those and send you guys an email with your assignment and connect you to either your assigned county lead based on how they want to do that. And then you can also, in the meantime, familiarize yourself with the forms and that are all in Canvas for this project. So you'll communicate and plan for your visits once you know which provider you'll be working with. Each county does it a little differently, so it'll just depend on how they prefer you communicate with them. Not how, but like if you're communicating with, for mine, I communicated with the like director, and then I met the provider doing the visits when I went to like observe them. So it wasn't like I was communicating with the provider, but some counties will assign you the provider and you'll coordinate with them when you're doing your visits. So it's just a lot of communication that we want you to keep track of on a log, because all that goes into your 8 hours of figuring out some of the coordination of all this. You'll complete your reflection for the assignment within 2 weeks of completing your hours, and the 2 due dates, depending on the timeline that you chose to complete the project, is either December 6th or April 25th. And we would love for you to be creative with your reflection. Okay, that's it. I'll just go ahead. Steph, am I okay just to show them the forms real quick?
Yeah, while you're pulling that up, I'll just point out that Erin, with her LEND leadership experience, created a dance class for children with intellectual and developmental disabilities. So when she says be creative, like you can do an interpretive dance on your experience. You can do whatever you want, but this is one of those things. The only thing that we are super rigid about in terms of your assignment that you submit is core exams, like the core reflections. You do have to do those in writing. But for this, you can do voiceover PowerPoint, you can do a podcast, you can do anything you want, anything you can be creative and think about, or you can do a written assignment, whatever works for you. Okay.
Really advocating for the interpretive dancing though.
Right?
Yes.
That would be really cool.
Okay, so like I mentioned, that this is your communication log. So even your emails, like coordinating your visits, the visits themselves, anything you do, we want you to write down and keep track of. The home visiting form looks like this, which we discussed is when you are observing the provider, and there just gives you some questions to think about while you're going through and looking. This is in no way, shape, or form means for you to like address these. It's more just if you have little notes to take. And then let's see, the family planning meeting, if you are going to that, those are some questions to turn in. And then on my tab, sorry. And then the team meeting, which is pretty straightforward and with other professionals. So I think that's pretty much everything. Everything's already in Canvas for you to check out and look over. Happy to answer any questions or now or via email or however, text, dance moves, dance offs, whatever you want. You guys have any questions?
I'm not seeing any in the room. Sorry, you just presented to me. I should have done this. Let me do this.
Oh,
Lisa.
wow.
Sorry, there they are.
Yeah. Thought I was just talking to
This
Dr. Hunter.
Echo chamber here. Yeah.
Yeah.
Yeah. So again, this is one choice, and then your next choice will be presented by Dr. Hunter. But thank you, Erin, for that
Yeah.
overview of the EIP.
Sure thing. Just let me know if you have any questions. Good to see you all.
Thanks, Erin. We'll
Yep.
send them your way so you can pop off now if you want.
Okay, sounds good. Bye, guys.
And then Lisa, if you wanted to go ahead and share your screen, that would be great too.
Okay, great. Can you see the presentation mode?
Got it. Yep, looks good.
Awesome. I think I'm finally mastering Zoom after 2.5 years. Hi, everybody. Good afternoon. This won't be a real long and hopefully will be a fun project to think about. And I really appreciate all of Erin's great introduction. It's really fun to have both the early intervention option available as well as the community leadership option. And within that, there's 2 other options. So it's kind of like Oprah. You've got options and options, and for everybody, there's an option. So My name's Lisa Hunter, and I've met you a couple times now. I'm the audiology faculty and the coordinator for the Community Learning Project. And this is a project that is just wonderful and so fun to be a part of. And I would have to say that thanks to Jen and Steph, there are so many fantastic options available to you to learn about. You may have already in previous service learning have interacted with some of these agencies that we'll talk about or organizations. And if you have, that is fantastic. But I would like to challenge you to pick another one. You might have a lot of comfort with, say, Special Olympics or another organization that you've worked with, and that's fantastic. But there are so many out there to learn about. And the more you know about them, the more you'll know how much rich work is being done and what a great community Cincinnati is for people with developmental disabilities. So that's a big part of this project, is just learning about that. So this project overall is meant to provide you all with the opportunity to learn about these organizations and learn about one more deeply by actually volunteering with it, or learning about it through option 2, which I'll talk about. So we want organizations that provide direct services or support to children and adults with developmental disabilities and to their families. So it's all about that community. And so service learning is a teaching and learning strategy that is intentionally put together to help you get meaningful community service and learn about civic responsibility, learn how we can strengthen communities, and also through that, learn about more of the LEND principles. So these are the maternal and child health principles, among others, that this project really focuses on. By working with the organizations, you'll learn how they, through your self-reflection, how they address ethics and how they communicate. There's always room for improvement, right? So if you have reflections about ways that these organizations can improve, know that that stays with LEND. We don't share that necessarily back with the agency, although they often share with us helpful comments about how we can improve this option and make it work better for their organization. So we do share that in a really positive way. When you have suggestions or they have suggestions, you'll learn a lot about cultural competency, because these organizations serve all sorts of people with developmental disabilities as well as their family. And you'll get to do a lot of teaching, coaching, and mentoring. I'll have to say that you all are really, really valued by the organizations as volunteers, because you come to it from a place of more understanding, more depth of knowledge, being, graduate students or being self-advocates or family advocates. You all have much of this experience to bring, but we all have a lot to learn too. And so the way to do that is really working hands-on directly with the communities and the systems. So here's just a few that we work with regularly. So we have agencies that we've gotten to know through experience over the years. And so these are pre-approved agencies for option 1 to do direct hours with. So Special Olympics, I think everybody is aware of Special Olympics. They have so many different adapted sports that you can be a part of. There's Be Well, which is sponsored by and developed by Cincinnati Children's, which is an adaptive community or program that gets kids out into hiking or yoga or lots of other activities. There's You Said, so Learn the Signs, Act Early, which Steph Weber heads up as that coordinator. And then there's the Cincinnati Art Museum, which has adapted programs as well. So a lot of these are sports, a lot of them are arts. We have Cincinnati Ballet, and physical therapy has been really involved through Michelle McGuire at Children's as well, and has this special program. I will say that if you are interested in the Cincinnati Ballet, we really want you to fill out your survey right away so that we can get you tapped in, because their program starts real soon. And then there's the YMCA, which is mostly adapted swim, and they have a huge need for volunteers, especially volunteers who can commit over a period of at least 7 sessions. So for about 2 hours each session, starting in October, and you get to kind of build a relationship with a swimmer. And so it's really important, if you are interested in that one, that you're able to commit to do that pretty much from October until it's through the winter months. And then there's Cincinnati Sled Hockey, Autism Society of Greater Cincinnati, which has quite a few online and in-person programs. And then Visionaries and Voices, which is an arts organization serving people with developmental disabilities who are artists. So I'm going to talk about option 1 first. This is the service learning option. So this is direct, mostly in person, although there are some virtual options as well. And it's 15 hours of direct service that you would provide to a community organization. And it can be done virtually if needed. There's been a lot of that obviously for the last 2 years, but much more of them are moving in person now. You can put this as part of your individual leadership plan goals or ILP goals to learn more about the organization. And then at the end of the year, you'll submit a self-reflection. Those have mostly been written, but I love the idea of other alternatives like interpretive dance, like Erin was talking about, or a song or a poem or something like that. I would be absolutely thrilled. It would be fun to read some of those or listen to them. So definitely would be fine with that. And I think I might add that to the instructions that you can do that. So that's option 1. And option 2 is where you would research a new organization. And so there are some that I've gone through and I've picked that we haven't really had any people choose before. So I've got a list of those agencies for option 2 in Canvas. You would interview a representative. Usually it's a director or a coordinator of the community organization that serves developmentally delayed people. And you would deliver a presentation on the LEND program to the organization. So you give them information, and then you would prepare a poster and a brochure on them that you would deliver to us in the spring. So it's by back and forth, give them information and share information back to us as well. So for either option 1 or 2, you'll include your choice as a written goal. And you'll fill out that survey. It's the same survey that Erin was talking about for early intervention. So when you get into the survey, you're going to first decide, do I want to do early intervention or do I want to do the community learning project, the CLP? And then if you choose CLP, then you choose either option 1, which is direct service, or you'll choose option 2, which is researching an organization where you wouldn't have the volunteer hours as part of it. For certain choices, especially Special Olympics, you'll have opportunities to be a leader as part of the placement because they really need that sort of leadership to help organize some of the sports. And then being a leader in CLP ranges from mentoring youth with developmental disabilities, planning activities, and then actually leading some sessions. But again, you're not responsible for more than the 15 minimum hours. Some people do choose to do more, but that's not required. And then here is an example of a great poster that was put together by a previous LEND trainee on a wonderful organization called 4 Paws for Ability. And so this poster is an example of the kind of thing that we're looking for in the spring, where you would talk with us about or show us the mission statement, vision, the goals, services, and recent highlights and how to find out more and what the contact information is. And that will be shared with all of the LEND trainees and faculty so that we'll learn more about that organization. Sometimes these organizations can become part of option 1 and we can then provide those as direct service volunteer opportunities in future years. So in April of next spring, we'll have our community leadership session, which will be the end of the year and kind of your capstone, if you will. And so the students who chose option 2 will present their posters. They'll submit the fact sheet or the brochure, however they want to do that. And then after the poster presentations, those of you who chose option 1, we'll just talk shortly, verbal reflections on your experience. If you come up with a dance or a song or a poem, that would be super fun, and we can, have that at that time. Again, a written reflection is absolutely great as well. And that is it. So be great if you have any questions.
Jen has something to add.
Clarify.
Hey, Lisa, it's Jen.
Hi,
I'm
Jen.
gonna add another option to option one. I heard back from the zoo about the dates for Zoo Troop for All. So this is Wednesday evening opportunity, and the dates are October 19th, 26th, November 2nd, and November 9th. And it's a 4:30 to 6 o'clock commitment. And it is helping out with a Zoo Troop for All class, which is a class for kids with developmental disabilities at the Cincinnati Zoo. And it's like about as much fun as you can have. So I'm going to try to sell that project and sizzle it, and I will be there. So
That
even
is
more
very
sizzle.
exciting. That's so exciting. I'm so glad it's available again because it's been extremely popular. And I will say there isn't a single one of these options that has been a dud, which is why they're on the list. Because I think we've had just fantastic feedback from our previous trainees about how wonderful the experiences were. Really about the only feedback that we get from the organizations about how we can improve is that if you commit to do one of these projects, it's really important that you're there, because the people that, you know, the folks who are there, who have developmental disabilities, really look forward to seeing you. They love you guys, and they, of course, are a bit disappointed if someone has to drop out after a little bit of time. So if you don't think you're going to have the time for it, I would really suggest choosing option 2, or maybe the early intervention project is better for your schedule. And we know that you're all really passionate about doing this kind of work. But if it's a scheduling issue, we really understand, and that's why there are the different options available. If you're having difficulty deciding, please shoot me an email. And I'm really happy to talk it through and, you know, help you find an organization that works for you and works for your schedule. And also,
If you care to unshare your slides.
Oh yeah,
Sorry.
sorry.
Hop back.
Also, do not have to be an Olympic swimmer to help someone with swimming. You don't have to be, you know, a hockey star to be involved in the sled hockey. You do have to need to know how to skate, you know, on ice, but you don't have to be a professional hockey player to do any of that. So.
And then Lisa, you on Canvas have posted the different options and short descriptions for each of the projects, or do you, I know that I have 2 that I've kind of, do you need anything else for me for the Act Early or the Rubenstein Library ones?
No, your description was great. So I added that for Rubenstein, and then Jen, I'm going to get with you to add in the Zoo Troop so that we have all the dates and times, because whenever we have that available, I try to put in the days and times to help with your choice.
I'll send you that, Lisa.
Great. And then we'll need to get Vicky to add it to the survey. So
the survey just went out
on that as well. Yeah.
So, all right. How about this? The survey should have just gone out. Wherever you get your red cap surveys is where you should go. So the survey that you took last week through Red Cap on diversity, equity, inclusion, it will be the same email address because everything is linked for your profile through that. You will get an email to complete the CLP or EIP preference. So option 1 is CLP service hours. Option 2, CLP research and organization. Option 3, early intervention projects. Whatever one of those you select, then it kicks you to your choices. Review those choices across the board. Let us know what questions come up for you. But if you'd like to select option 1, Zoo Troop for All, don't make any other selections, just type it into the box. There should be an open-ended box for you. Just type in, I want to do Zoo Troop. That'll be the way we get around that.
That sounds good. That's perfect. And
if you have any specific questions about Zoo Troop, you can contact me.
What questions do you all have about either of those projects right now?
Steph, I didn't really cover the babysitting. You said babysitting.
We're not doing it. We're not doing it.
Okay.
It's off. It's off the list. Yeah.
Okay.
Off the list. I had Vicky remove it.
Okay. I'll need
Yeah.
to
So if you can
update
make
that.
sure it's off your list.
Okay.
I had to cut something this year.
Yeah, you're doing a lot.
Doing a lot. Okay, Nellie had a question.
Did you say when we have to complete the survey by?
It's in Canvas, and of course, I don't have it memorized, but it's an assignment in Canvas, and I'm sure we gave you at least a week.
Yeah, I think it's September 6th, by next Tuesday.
So yeah, a week from today.
As soon as you select something, if you're selecting ballet moves, if you can also send me an email so I can get you hooked up quicker for that, because they get going pretty early.
Maggie, you already got connected to that. Was that you? No, it was Maddie. Maddie that got connected to
yeah.
that,
That was
I think.
me. Yep.
Okay, so you're good. Excellent. Caitlin had a question. Go ahead.
Mine was like that specific question about. Say one more, go ahead.
Yeah. Lisa, my name is Caitlin. I had been communicating about the Bridge Adapted Soccer Program for kids with CP.
Yeah.
I wasn't sure if you wanted me to reach out to you directly to kind of talk about that program, just because that was the option I was kind of leaning towards if it's appropriate. So wasn't sure your thoughts on that.
Yeah, that would be great. We've actually talked with Sally about that and with Steph. So I think we have a good plan that will work well for you. And so let's connect by email and get that going. It's kind of a hybrid of option 1 and option 2.
Okay, sounds good.
Go ahead. If you can pass it to Rania.
If I select first option, do we stick only to the one opportunity or can we try two of them?
We always get this question. Yes. So I would say choose one now, and then we can revisit with your core faculty if you wanted to do the other one as well. That's the nice thing about all of these options is that, say, for example, you choose community leadership, service learning this semester, and you get everything done because you do Zoo Troop for All with Jen on Wednesdays. And then over the winter break, you go to your core faculty and you say, I'd really like to do early intervention project. Well, we could still possibly do that, but let's get you all into all the projects first, and then we'll see what happens about halfway through the year. Is that what you were talking about? Or were you talking about CLP option 1 and CLP option 2? That's what you were talking about. Okay.
Yeah, I do have another question. Like in the ballot moves, they mentioned like timings that we need to go on. So do you need to go on like they mentioned Monday, Thursday, and Saturdays? Like, can I go based on like availability? Like, let's say I'm available only on Saturdays. Do you need to attend the remaining 2 days, or can I only go on Saturdays?
No, I think my understanding is that the expectation is only one of those days.
Yes, that's right. And the days can be flexible depending on what works for your schedule. We're just, the minimum expectation is that over the year you would do 15 hours. And so a lot of this is schedule dependent, and most of them are available on Saturdays. So Saturday is the most common. If anyone has time during the week, the only one that is only during the week and not on Saturdays is Visionaries and Voices. They're really kind of.
And Zoo Troop.
And Zoo.
And now Zoo Troop.
Yeah, Zoo Troop's after hours, but like Visionaries and Voices is during the day, which a lot of land trainees don't have time during the day, but if you do and want to do that, that's a great option. But
And if I will sizzle the Rubenstein Library project and the Act Early, is that you can do it in the middle of the night on either project. I don't care when you do it. You can do them on Sunday night. You can do it on 2:30 in the morning on Monday. I don't care when you do it. We'll just meet periodically and see how things are going. And you do it whenever you feel good.
And I hope the survey stuff has the ability for them to choose like 1, 2, and 3, like rank your choices. That's how we've done it in the past, because most of the agencies, we want to spread the love around a little bit and have you guys go to different places.
I know I did many iterations of the survey with Vicki, so I'm almost positive that I made it so that you would put in 1, 2, and 3.
Okay, great.
Within those choices. Other questions? Yeah, go ahead, Michelle, if you want to grab the mic.
I don't have Canvas up, so I'm sorry if I'm repeating this, but is there a description of what you're gonna be doing exactly at each of the service project locations? Or is, okay.
Pretty much.
Good question.
If you
I
want.
would
more-
say ish. Some are more descriptive than others, right? Because sometimes you go to Special Olympics and you think you're gonna teach gymnastics, and then you might need to teach long jump.
Right.
I don't know. Like, it's very, just gotta put on your flexible pants in a lot of them. Right, Lisa? Like, you've done good descriptions of what we know. I guess. Good question.
And I've
We
put
have-
in websites where they're available for each of them. Some of the organizations are more up to date than others, but all of them will have a basic description, you know, of what that program is. Except for the Adapted Swim. So Emmy Lyons Adapted Swim is a wonderful, wonderful organization, but you won't find any information about it on the website. But it's basically on Saturday mornings, and you go there and you know, kind of like with the Ballet Moves, you establish a more one-to-one connection with a swimmer, which is really cool. And, you know, you don't need to be a professional swimmer, and they have a real need for volunteers. So I'm going to really push that one.
Sizzle. Yeah.
Like, how good of a
Oh, like, you can't drown by yourself. Okay,
Right.
so you have to swim enough to get.
Basic skills.
Yes. All right. Swim safe skills. Good question. Yeah, Johnny has a
Just a plug for that program, because my son, who's now 20, did that program. That's across.
The Adapted Swim?
Yeah, it's across from Christ Hospital. That where it used to be.
Where-
They may have moved pools.
I'm not sure.
But anyway,
Similar program.
that's how we learned how to swim.
Oh,
Was that
wonderful.
program. So
Yay. It works.
It does definitely work.
If anyone has questions about BeWell,
Be
I
real,
can
be
answer
real.
them.
Yeah.
And also share information as needed, because the programs happen throughout the year. And they may just be like a one-time thing or like multiple weeks. Like biking, it was several weeks. Most of them go for 6 or 8 weeks.
For those of you guys in virtual land, that was Katie, and she has led some of the Be Well initiatives, so she can help out with that too. Other questions? Okay, I know it feels like overwhelming, but, right, everyone's like, oh my gosh, but what happens, what if we would have given you this information 2 weeks ago? Would you have come back? No, right, it's better that we get to now, right? Okay, so we're gonna do a little fist of 5 here, a little activity. If you feel really good about the choices you're gonna make, you feel confident that you know what's going on, you got a good handle on it, give us a 5. If you're like, I'm really gonna need help, put up a 0 and anywhere in between, 1, 2, 3, 4, or 5. Guys, you're killing it. Yes, okay, for the most part, we're doing okay. And honestly, those, if you didn't have at least a 3 up, trust me, you'll get there, right? You've seen Erin on here, you saw Angel come in, you've seen Allie, like, they get through it, right? And you don't just get through it, you get through it with flying colors and you have a great experience. So you will get through it, it is a lot. And here's, again, going back to our first presentation, the why. So the why that we do all these things is because of those MCH competencies. And when Jen and I, in 2021, right after Easton was born, we wrote the grant to try to get the LEND program again, right? And we did check, we had to do all these things. And all of these projects were viewed so positively by the reviewers that they gave us 100%, 100 out of 100.
Oh, wow.
So that is the why, because the federal government said, we got a really good program. So we then just keep doing the same thing every year because it's working. So if you ever have any questions though, again, you've seen faces from last year's and the year before, Allie, Angel, and Erin. Ask them if you don't feel like, okay, I don't want to ask Stafford yet, but ask them. They'll be very honest, right? They'll be very honest with you. We'll be very honest. Obviously, I'll be very honest with you, but you will get through it. Okay. So that being said, thank you, Lisa. Fabia, Maddie, if you're
We're hand chosen.
Vice
So the purpose here is Sally and I, Sally and I this semester, we're gonna support you. We're gonna be in all the meetings. We're gonna help you out. So will your faculty. So you're on teams where your faculty come pretty consistently. It's okay if you want to sit kind of near your faculty. If your faculty person's live, we're hoping they are. If you want to sit near Sally and I, so we can kind of help you out, that's fine. But the idea is that ITT is going to become, we don't want to do all the talking and all the probing. ITT is going to hopefully become presentation and conversation amongst all of you. And you're going to help us move that conversation piece along. So there are going to be assigned people who are going to talk. They're going to stand up here, and they're going to talk. Some of them are going to talk for a long time. Psychology always talks for a long time. But there's going to be some like assignment of we know someone's going to talk for a long time. But we want there to be interaction. We want people to ask questions of one another. Not all, if it's psychology presenting, it's probably not just questions for psychology, but it might lead to a question about another piece of like, oh, that came up in psychology. In OT, we would do this with that. So hopefully some of that conversation comes around. Training driven. The other thing about ITT is we want the family perspective. Oh, Elizabeth, you got the family piece. And we can meet with your family members separately too. But it's family driven, and we are going to talk about some of the social determinants of health. If no one else does, I'll ask questions. So these are the roles of each team has 4 team leaders. These are their titles. Some of them are direct, some are less direct. Evaluation coordinators are you guys this semester. I can tell you now who the kids are. I can tell you they're MRNs. I have all of them.
That'll be great.
They're already in your schedule. These kids are already in everybody's schedule. They're scheduled to Pam. It's Tuesday morning. Pam will supervise these with you. They're already scheduled in Epic correctly as of this morning. So we already know them. But part of the evaluation coordinator is you're going to introduce the rest of the team to these kiddos. So on September 13th, we come back. The last like half hour or so, Sally and I have to talk fast. The last bit of that day is you guys introducing these kids to your teams. Who are they? What are their names? There is no presentation format that you have to do that day. You don't have to do a PowerPoint. You can do one if you want. If that helps you organize, that's great. Sometimes you're gonna look at charts and there's like any referral. There may be no information. Some of these, I think one of these guys does have a lot of care everywhere information, not our information. So you're gonna introduce the team. So that's part of the evaluation coordinator is introducing the child to the teams. Reason for referral. You also are kind of helping synthesize the information as we go along throughout the semester. And you also are going to lead the ISS. So the ISS for both of these patients are also scheduled in the Pam's schedule. But you'll lead it. So at the ISS, the information sharing session where we go over all of the evaluations and results and make treatment recommendations of planning the family. Other team members might be there also, but that's something you plan for during the semester. Family. Help us keep the family perspective. The other piece of the family is also helping us remember what the family's questions are and what the family was seeking, because sometimes, we get into these evals and we get stuck in like where we're coming from. So we're gonna ask our family trainees to help us remember this is what the family was looking for. Did we answer this yet? And if not, who's going to answer that?
I think it's important to think about when you get together and you discuss the case at the end. I recall when doing my year, and everyone was caught up about how to arrange the evaluation to do all this stuff, and the person was actually needing a kidney transplant. So I was listening to all this conversation about timing and everything, and I'm like, hold up a minute. Are you remembering this person is in such, physical challenges? So I think that that's where the family perspective comes in so nicely.
The meeting leader puts our agenda together. I don't remember who was what. Okay. So the meeting leader puts the agenda together. There's a sample agenda on Canvas already. So the meeting leader probably, last year was the first time we tried this, where if you email the people who are coming up on the schedule at the following meeting. So the first meeting is genetic counseling, audiology, fellow, and social. If you email them about a week ahead of time and say, how long do you think you're gonna need for your presentation? It helps to make an agenda that's realistic. So here's a sample of the agenda, but people used to just put everybody got divided to 2 hours and everybody got an equal amount of time. That became a problem if we had some disciplines going on the same day who both need a long time. And then the next week we had 3 disciplines who were like, I need 10 minutes. But Marta's really.
I try.
Marta is incredibly gifted. Marta's been.
I try.
Scheduled for weeks and weeks and months. And she plays this game of Tetris and we just go, thank you, Marta, because this is amazing. And then a kid gets sick. Right. We schedule it all and she still figures it out.
Right. And then we also, you're the timekeeper. So giving people warning. You said you needed 20 minutes, you're at 15, you're at 20. Sometimes people won't listen to you and then start shooting us.
I feel okay with that.
Good. Yeah, you were picked for this role. And then, so obviously there might be sidebar conversations. The conversation may lead to something else, right? And it's educational, informational. Also help us remember that we need to stick to our agenda, especially if we're running tight on time. And obviously, you can put things in the parking lot. So that's the sample agenda. The note taker, shockingly, takes the notes. So you're recording the notes. We used to do like minutes, agenda and minutes. We changed that because we have a case conference sheet. So that last meeting before the information sharing session, we do a case conference meeting. So to simplify things and we think it helped, I feel like it, we always take feedback. The note taker started taking notes on the case conference planning worksheet and then updated it every meeting and put it up, the most updated one, onto the ITT meeting page. So that way, the conference sheet breaks down by discipline, breaks down treatments, breaks recommendations, breaks down strengths. We're always looking for patient and family strengths. So it highlights. Remember, we need to fill in pieces. So this is where we've started taking our notes. It is not the note taker's responsibility to write down all of the findings from the evaluations because the presenter is going to put them on Canvas. The presenter makes a PowerPoint, that PowerPoint gets uploaded to Canvas. That specific findings are going to be there. This is like the highlights. So you might put on there IQ, full scale IQ was, DOS, it was, Vineland scores, because sometimes those numbers are really important. Mine wrote about what we do next in treatment services. So we do ask that you post the minutes, so the case conference sheet, by like Thursday. So Thursday afternoon, Friday. And then there's the case conference.
So this is all on Canvas, so we see this presentation.
This presentation's on Canvas today,
Okay,
under today's in-depth conversation.
that's fine.
And then the link, so there are the blank case conference sheet,
Okay,
that's on Canvas on September 13th when we come back.
okay.
So that's a big ITT, 3 to 5. You're gonna hear from Sally and I a ton. So there's a ton more ITT documents that day. But there's a blank agenda there. There's a blank case conference sheet there, and there's other documents that are needed for ITT on that.
So the note takers are just responsible for the case conference piece of it.
Yes.
Yeah, okay.
And not, you won't do anything. You'll take your first notes, the first full ITT meeting for your team. Not September 13th, where these ladies are just telling us about it. You don't have to take notes. So not until your first full meeting, which for one of you is September 27th, and for the other one is October. So prior to the information sharing session, we go back over that case conference sheet, which we've been working on all semester, makes it way easier and faster to fill out, and we can spend more time actually talking about the kid, the family, what are our recommendations? How do we share this information? Who wants to be there? Sometimes the evaluations come up and their findings are a little interesting. They go, guys might be like, it'd be really great if speech was there to like explain this to the family. And then we try to work that out with schedules. And then that is where we do come up with our final diagnoses that are gonna be an epic, so it'll be in the chart. We prioritize, we make recommendations, helping, kind of thinking where did the family come from, what did they want answered, making sure we address that, making sure we have answers to the questions we know they have. Now, people come in with extra questions, right? But making sure we have answered the questions they asked for from the beginning. And then we have the ISS meeting. Team 2. I don't remember which one. Team 2. The family is out of town when I originally scheduled the ISS. So we moved it back to December 6th. On December 6th, our teams come back together. So you will not have a whole presentation to give, but the kid will be really fresh in your mind about how the ISS went because it just happened that morning. So the information, and then, so you guys will leave the ISS, we'll figure out who's gonna be with you, if anyone, depending on how it goes, how the family is, maybe the family's been pretty open that they don't want a lot of people in the room with them, that makes them uncomfortable, and we won't put a bunch of people in the room with them. So we're just gonna have to go off the field with them for that too. And this is just who you all are again. Do you have any questions about your role, concerns?
I'm laughing out loud a million.
I know I'm gonna miss like one of the meetings, October 4th.
Yeah.
I'm not presenting, but that's fine,
I
right?
rescheduled one of the
Yeah.
presentations to make sure you weren't presenting, yes.
Yeah, the schedule on campus looks good, like I'll be here that day. Okay, so but from our role, it's like not a problem.
Pam will be here. Pam usually comes even if you guys can't come.
Okay.
So Pam will likely be here for, you're probably, Maria, are you missing one too?
Yes.
So Pam
October
Pam will come.
Provide-
And so if there's questions for medical, Pam will usually just
Okay.
answer them that day. So a lot of times, if a discipline is missing, their faculty or supervisor, depending on the discipline, different people come. But their faculty or supervisor usually still comes.
I know I'm missing one day in October, a Thursday. I just don't know if it'll.
These are all on Tuesdays.
Okay, well then we're good.
You're good.
Good.
These are only on Tuesdays.
That's good.
If you know you're gonna be gone, let Sally on an ITT meeting, but especially note takers. Like if you're sick even, sometimes we figure it out. Sometimes we get a heads up, depending on how things are going. If you know you're gonna be out one of those days, let us know so that we know. Stuff happens. Figure it out.
Does any, you might have said that I stepped away for a moment, do any of the results go into my chart before you meet the ISS?
Yes. If the note's signed, it goes to my automatically. So that everything about ITT is done the exact same way it's done in your clinic and wherever you work, whatever you do. So as soon as you sign it, it's on my chart.
Does that mean open encounters are?
Open account, if it's not signed, it's not seen. It's not completed. Yeah. It's not till you hit sign that it shows up in my chart. Okay. If this is not my slide, so any conversation we should have. So on September 13th, I also talked about mandated reporting in children's services and stuff. If there's something that makes you feel like if someone could be unsafe because of your documentation, you can turn it off from sending to my child. So then it
They're like
prompts,
very special,
yeah,
right?
yeah.
Like,
It gives you a prompt.
A very special circumstance.
It gives you a prompt, and you have to pick one of those things, but it prompts you to say, they're both about safety. Either safety of the child or safety of someone else if someone were to reach this.
I think there are other very rare exceptions if you
Yeah.
like talk to someone.
Right. Like I use it, I work in site, so we use it sometimes, but it is rare.
We
that
probably,
we
like,
use it.
we probably use it more than other people. But certain things they say would automatically go that way. So you have to pick it. So that's, I should probably talk about it next week, because if you do a child abuse reporting, you have to click that. Or else it will be shared. So, but yes, as soon as an encounter is signed, it's in my chart. So yes, families have results. If they have my chart, they have results before you talk. Can, not always.
So let me, from the note taking perspective, so every Tuesday, we're taking notes.
Every other Tuesday.
Because your team.
Each team,
Oh, that's
your
right.
team will only meet every other.
Every other, and then they have to be within, back in and posted in 48 hours.
We would really appreciate it. If you have circumstances, if you're gonna be out of town, you know it's not gonna happen. We're not gonna like, hunt down and breach or anything. But that would be our goal. So that the people planning for the next meeting will have all of that information. So ITT will be recorded. If you miss ITT, I think it's, you're supposed to watch the recording to see if there are any questions or anything you need to add to the discussion. But that's in the assignments.
So I'll mirror what Sally said, you do a great job, Margaret. It's a lot of logistical wrangling and you do it with the Children's Way of Grace. So I appreciate it very much.
Try. I don't even know how to log her out. Okay.